Good afternoon and welcome to the Delaware County Needs-Based Plan and Budget Meeting. My name is Vanessa Pierre. I'm the Administrator for Children and Youth Services. I'd like to welcome Beth Pradell, Deputy Administrator, Dorothy Stewart, Director of Policy Planning and QA. From the Office of Juvenile Probation, I'd like to welcome Danielle DiMatteo, Director, Jeremy Demia, Deputy Director, Dan Burke, Fiscal Consultant, Phil Gerace, Supervisor, and for Admin Services. For juvenile detention, I'd like to welcome David Irizarry, Superintendent, and Kirshna Hilliard, Deputy Director.
Okay. Thanks, Vanessa. Just to discuss the goal of this meeting, it's for public input on the needs-based budget for the years 24-25. And that includes the Office of Children and Youth Services, the Juvenile Probation Office, and Juvenile Detention Services. Now, this plan does take shape through various stakeholder engagement activities that can include the Children and Youth Administrative Team, the Juvenile Probation Administrative Team, families receiving services through these agencies, the Delaware County Juvenile Court and Children's Roundtable, and provider engagements as well. Guardians ad litem, county solicitors. So there's a lot of input into the goals and mission of the needs-based budget process. So I'll turn it over to CYS for their overview.
Okay, I thought I would see my PowerPoint up there. Let me bring it up. Okay, thank you. I don't think I'm moving it through. Okay. We'll get to our tentative allocation. Okay. Hi, I'm Dorothy Stewart. I was just going to talk a little bit about our budget for 23-24. So Delaware County has received a tentative child welfare budget allocation from the Pennsylvania Department of Human Services, Office of Children, Youth and Families. Our tentative allocation is $52,851,097. We'll receive our final allocation usually in August every year. In addition to our child welfare budget, we have special grants approved in the amount of $7,426,036. And these cover things including independent living, housing, and a lot of evidence-based programs that the agency has in place. So looking at the needs-based budget is actually planning for fiscal year 24-25. So the needs-based budget request for fiscal year 24-25, this time is going to be $56,458,467, which is a requested increase of $2,213,913 or 4% from the 23-24 implementation budget. Now, a significant portion of our increase is contributed to salary and benefit increases, new regulatory requirements from the Family First Prevention Service Act, and also increased per diems for placement services for children. So the child welfare budget is funded through a combination of state money, which is 67% of our budget, federal money, which is approximately 12%, county dollars, which is approximately 20%, and then other funding. So in addition to the funds that we requested for 24-25 budget, we are also requesting $8,163,689 for our child welfare special grants. So in fiscal year 22-23, the year that just ended, Children and Youth Services completed over 3,000 investigations for child abuse and neglect, and ongoing services were provided to over 600 Delaware County families to ensure safety for their children. So I'm going to talk about some of the strengths we did have this year. So Children and Youth has continued to utilize our family engagement services, which includes family group decision-making, crisis rapid response meetings, youth transition conferences, and family findings. So when children need out-of-home placement, Delaware County has actually been able to increase our use of kinship care for those children. The use of kinship care this year, days of care increased by 25% over the prior fiscal year. And the number of children in out-of-home placement in 22-23 decreased 15% from 21-22. Some of our other strengths is this year we were able to contract with MVP Recovery for certified recovery specialists. So we have a certified recovery specialist in each of our site offices. Now, these are people with lived experience that are able to reach out and work with our parents to begin their recovery journey and to access community-based services. They receive extensive training in helping people struggling with addiction, and they've been an incredibly helpful addition. We were also able to expand the number of evidence-based services for our families. So we now have Triple P, which is a parenting program for parents with younger children who have some behavioral concerns. This is an evidence-based program. We also have Nurturing Parents. We just completed an RFP process for that. We're working with 2 providers on Nurturing Parents, which is going to provide groups for fathers, for parents who have maybe some intellectual or developmental disabilities, some parents who just need very specific parenting geared to them. We also have Y-Try, which is an evidence-based program to deal with truancy. Now, we've embedded the Y-Try program in Chester High School and in William Penn High School, and we also have it extending to other children in the county that could benefit from the service. Finally, I wanted to talk about, we worked very closely with a provider this year to develop an emergency shelter in the county, which was something that was very much needed. So in July of 2023, the Delaware County Emergency Youth Academy opened its doors. And we've continued to work with the Office of Juvenile Probation on the multi-systems integration project to meet the needs of multi-systems involved youth. That would be children and youth, juvenile probation, mental health, and the education system.
Hi, my name is Beth Pradell, and I'm the Deputy Administrator of Children and Youth, and I will be talking about the challenges. Recruiting and retention of qualified staff is the agency's greatest challenge. We have a 46% vacancy rate for our caseworkers, which also includes placement services. In our intake department, the vacancy rate is over 50%. Of the caseworker positions that are filled, 35% of the staff have been here 2 years or less. And this is a job that takes at least 2 years to get a sense of how to manage things. And so at this point, we have 35% of our staff at those years of service. Having these caseworker vacancies leads to high caseloads. So our caseworkers are trying to manage what is a very difficult and on some level unmanageable caseload given the vacancies. We have 56% of social service aid positions that are vacant. Social service aides are paraprofessionals that work with our caseworkers in providing service to families. And we also have a 58% vacancy of our clerical positions. Additional challenges is that we have experienced a significant increase of the number of children with severe mental health challenges, or they may have current or prior juvenile probation involvement, aggressive behaviors, and/or intellectual developmental disabilities that require agency services, often placement services. So in having children with those issues, it makes it very difficult for us to provide service in finding placement facilities for them when they're not able to be managed safely at home. We have children that are sitting in hospitals for months, close to a year at times, because we cannot find a placement facility for them. And we have children that have been recommended for medically necessary residential treatment facility, but we've had difficulty finding residential treatment facilities for these youth to include exploring outside of the state of Pennsylvania. Parents and other family members have also been unable to care for their children, even with the community supports due to their behavior. It's been extremely challenging, as I said, to find appropriate placement settings for these children, and private providers cannot meet their needs. Some of the private providers, there's so many children in this situation that they can pick and choose who they will accept into their program. So it really leaves us in a challenging position, knowing that there really aren't providers that can accept all the children that we have. When children are recommended, as I said, for medically necessary residential treatment for mental health, there's long waiting lists and also difficulty for us to find placements within the state of Pennsylvania. Other challenges, children and youth has also been confronted with a large number of youth in non-reimbursable placements. So youth over the age of 18 with intellectual disabilities have not been able to move into the adult IDD system. Children and Youth Services has continued to assume placement responsibility for these youth. But with the lack of resources, they are placed in adult IDD settings. But with the lack of adult resources, Children and Youth is absorbing the costs. So we're having to pay for these children that are not able to be, the cost is not able to be assumed by the adult IDD system. Despite overall placements decreasing, the agency has experienced a 16% increase in the use of group home placements over the past fiscal year. And that's primarily because the youth that we are placing are so very challenging, and so they are requiring a higher level of care when we can find a group home that will accept them. Priorities. The first priority of children and youth is to stabilize the workforce and to focus on retention and recruitment of staff. The agency is working with the Office of Children, Youth and Families and the Public Financial Management Group on a child welfare recruitment and retention project. The project will last 8 months. It will include analysis of hiring practices and focus groups with key stakeholders. The agency should receive specific and actionable recommendations to improve the recruitment and retention process. To help with retention, salaries were increased for Children and Youth Services in fiscal year 22 and 23 after a compensation study was completed by the county. Staff development also continues to attend job fairs as well as monthly county job fairs and to recruit staff. And the county is also working to leave the state civil service system for a county merit-based system, which we're hoping will make a big difference in being able to get staff in quicker. In alignment with the Family First Act, Children and Youth Services continues to prioritize decreasing the use of congregate care settings for children. When we're able to do that, then our goal is to have them in the least restrictive placement. The agency is continuing to increase our outreach and our engagement of kin in planning for vulnerable children. This is also a priority for the courts and the Children's Roundtable. The agency will increase staffing in the family engagement unit that we have at the agency. And when agency staffing is stable, we will continue to use crisis rapid response meetings, which are meetings that we hold immediately after there's been an identified situation where a child may need to go into placement. We have also contracted with Bethana, who is a private provider, to recruit foster homes in Delaware County. The agency needs foster homes that have the training and ability to care for older youth. Older youth are the hardest population for us to find placement facilities for. Delaware County also remains focused on continuous county improvement. The agency will continue to address goals and priorities developed after our last quality service review. We look to improve outcomes for older and transitioning youth to ensure that there is an identified and workable plan for education, housing, income, medical needs, and life connections for youth who are transitioning from out-of-home care. And finally, we release a request for proposal for family mental health interventionists who will be able to accompany our caseworkers to the homes and meet with the families or the child who is experiencing a mental health crisis or a severe parent-child conflict at the time. They will provide crisis management and intervention for the families and to help to stabilize the difficult situation. So I'm going to turn this over to Jeremy to talk about juvenile court.
Thank you, Beth. Again, I'm Jeremy Damia, Deputy in Juvenile Court and Probation Services. So I'm going to give you just a brief overview of the probation department. And again, our role here in the needs-based budget process is simply for the payment of our contracted services. It does not cover our whole operating budget like CYS. So first and foremost, our home office located here at the Media Courthouse Complex. You can switch the slide, please. We have other office locations throughout the county to make the clients reaching us easier. One office in Chester, one in Sharon Hill, and one in Upper Darby. Next slide, we'll just briefly go over the roles of the juvenile probation officer. We operate under the authority of the president judge, and I'm certainly not going to read each bullet point individually, but first and foremost, we enforce the court's order. We supervise juvenile offenders, whether that be offenders on formal court involvement or through diversionary programs. But the moral of the story here is the probation officers wear many different hats in serving the kids that come before us. All of our actions are guided by barge principles, balance, and restorative justice. And the three pillars are noted there in the screen: victim restoration, youth redemption, or as it's known, competency development, and protecting the community. But all of our actions should follow that barge principle. I have this next slide here just to give a snapshot of, the volume of cases we handle here in Delaware County. As you can see, Delaware County routinely handles a high volume of cases compared to other counties in the state. Philadelphia and Allegheny counties are highest, but there's a couple of counties, close to us that have similar numbers. Lancaster, York, Delaware County, and Montgomery County are generally in a close proximity of numbers. And I will say our numbers compared to 2022, so far this year, we're trending upwards to 30 to 40% increase in our case filings with the court. Okay, next slide just shows the placement percentage as a percentage of all dispositions. And you can see that we have a very low percentage of placement episodes compared to the number of dispositional hearings and dispositional review hearings that we have. So I think that shows that, placement is a last resort, but it cannot be avoided totally. So again, just shows the volume, the heavy volume that we handle here down in Delaware County. Our next slide will just give an overview of our system enhancement strategy. Now, this is the years, and it's going to keep us busy with refinements and changes to the process, using evidence-based models, evidence-based initiatives whenever possible. So this is a very long process, and this process combined with effective services through the needs-based budget, we hope continues to lower recidivism and effectively serve the kids and families in Delaware County. So I'll turn it over to Dan. Dan will just talk about some numbers and some trends before we finish up with our detention director.
I'm Dan Burke. I'm going to be discussing recent placement and detention trends, as well as juvenile probation's accomplishments during fiscal year 22-23 and probation's challenges and priorities moving forward. Probation placement admissions have seen a steady decline over the last decade, with the number of juveniles being placed decreasing every year since fiscal year 12-13. 10 years ago, probation saw an average of 400 plus juveniles being placed each year. But as you can see, placements have dropped significantly year after year since then. In fiscal year 22-23, placement admissions dropped to just 29 juveniles being placed. While the decrease in placement admissions was a steady downward trend every year since fiscal year 12-13, you can see between fiscal year 19-20 and 2021 that admissions saw an even steeper decline with the onset of the COVID-19 pandemic and the subsequent closing of the Delaware County Juvenile Detention Center. Juvenile probation has also seen a steady decline in detention admissions over the last decade as well, following a very similar trend as seen with the placement admissions in the same time period. The closure of the detention center in March 2021, of course, contributed further to this decline. As you can see, detention admissions decreased from 209 in 2021 to just 70 juveniles in fiscal year 21-22. After the closure of the Delaware County Juvenile Detention Center, probation was left with very few detention options, most with long waiting lists, resulting in just 42 juveniles receiving detention services in fiscal year 22-23. These low placement and detention admissions have also resulted in record low expenditures for juvenile probation, driven mainly by the closure of the Juvenile Detention Center. Probation projects that expenditures will remain below budget in fiscal year 23-24. However, it can be expected that once the Delaware County Juvenile Detention Center does open, expenditures will see a significant increase down the road. A major accomplishment for juvenile probation in fiscal year 22-23 was decreasing placement admissions by 23% compared to fiscal year 22-23, or compared to 21-22. In addition, probation has continued to expand contracts to include supplemental shelter and security detention services following the closure of the detention center. Detention providers continue to be in high demand, so bed space is extremely limited, but probation has made great efforts to contract with all possible detention options available. Probation has seen a decrease in the number of juveniles replaced within 1 year discharge from placement to its lowest record levels on record, with just 10% of juveniles being replaced. Probation has seen a downward trend in recidivism for each of the last 5 years. Probation has also expanded residential and non-residential resources within the state. However, youth with the most complex needs and aggressive behaviors remain a challenge. Juvenile probation also faces some significant challenges moving forward. The largest challenge will continue to be the lack of local detention beds. There has been an increased demand for detention beds due to the Juvenile Justice Reform Act of 2018. It is estimated that approximately 2% of youth are in need of security detention. However, detention resources are unavailable throughout the state. Due to the closure of the detention center, there is now an increased reliance on supplemental security detention. However, many juveniles are denied admission to these detention services due to lack of detention beds or due to a juvenile's aggressive behaviors. As a result of the lack of detention beds, there has been a significant increase in juveniles receiving JPS services as they wait for a detention or placement bed to become available. In addition to the lack of detention bed, probation has also experienced a lack of available mental health services, drug and alcohol services, and specialized residential services. Probation has seen an increase in juveniles being denied admission to these programs, as well as a very long waiting list for juveniles that are accepted to these programs. While probation has seen a decrease in recidivism rates over the last 5 years, post-placement recidivism still continues to drive the need for placement services. Many juveniles that are rearrested post-placement have to wait long periods of time to find an open placement or detention bed, and placement has to resort to GPS monitoring while awaiting bed space in detention or placement facilities. Juvenile probation will continue to make it a priority to increase collaborations with Pennsylvania OCYF, sharing information on county trends and spending to ensure adequate funding. In addition, probation plans to collaborate with CCBH, the new managed care organization, and to enhance school-based mental health services. Probation will continue to employ secondary and tertiary prevention practices to reduce or eliminate the risk factors which lead to delinquency. Juvenile probation is making it a top priority to continue to develop our local resources and increase access to statewide resources. Probation will continue its efforts to use the least restrictive and most appropriate settings to rehabilitate juvenile offenders, with strong focus on community-based providers and alternatives to placement and detention. Probation will continue to make it a top priority to enhance multi-system collaboration and will continue its efforts to reduce the days of care for both secure detention and secure residential placements while enhancing aftercare and in-home services for juveniles exiting placement or receiving services within the community. I'm going to pass this over to Dave. He'll discuss detention.
Thank you, Mr. Burke. Thank you, Director Damia. So as our partners in juvenile court has stated, our detention center has remained closed for the entirety of fiscal year 22 and 23, but our mission of our department is consistent, making sure that we're ensuring public safety while promoting positive social change in high-risk young people. Kind of high-level overview of some of our accomplishments in FY 22. I definitely want to highlight our initiative with the Center for Children's Law and Policy. We conducted a baseline evaluation of Delaware County's primary prevention, diversion, and reentry services. This initiative included a full-time Stoley Fellow, who's a juvenile justice subject matter expert in the state of Pennsylvania, a partnership with the National Assessment Center, an assessment of 500 Delaware County youth, an analysis of current Delaware County juvenile justice related data, an overview of Delaware County's prevention and front-end diversionary efforts, and we're working toward producing a set of recommendations to our county leadership. Next slide, please. We also conducted a series of listening sessions in local communities most impacted, and we use that input to create the design of a future local center here in Delaware County. As we reflect on, next slide, please.
Sorry.
As we reflect on the upcoming year, FY 23-24, our main priority and our main challenge has been consistent throughout. It's our lack of local detention resource. There was a recent study by the JCJC called Pennsylvania Secure Detention Bed Gap Analysis, and it showed that, in fact, there was a surplus of beds within the Southeast region. But with the operational constraints of our partners who we do contract with, as it relates to staffing, retention, recruitment, so having that reliable source for our partners in the juvenile court has been our greatest challenge. Next slide, please. Moving in again to FY 23-24, our priorities for our department's priority vary. I would say first and foremost, we're going to continue to collaborate and negotiate potential partnerships with neighboring detention centers, specifically in the Southeast region closest to our young people in Delaware County, with the goal of establishing a longer-term resource for secure care services, utilizing a regional model. We've already engaged in some of those preliminary conversations, and we're hoping that the fruits of our labor are produced after that. We're also going to look at the impact of reallocating resources away from detention and investing more in community-based programming. Some of those potential programs that we hope to be considered are as follows. Next slide, please. The development of youth evening resource centers, right, with the goal of addressing out-of-school time in communities that are most impacted, focusing on pro-social activities, food disparities, and safe supervised community spaces. We also want to amp up our school prevention programming efforts, addressing root causes and early indicators of delinquency, and that could potentially be a targeted intensive service delivery, as well as investing in additional safe corridors within schools. We want to be able to provide youth assessment centers in the communities that are tasked with connecting young people and their families to the available services that Delaware County has. We're looking forward to the partner with our district attorney to expand youth aid panels in highest risk jurisdictions. And we also want to participate in developing workforce development, reentry programs using restorative justice practices and principles. And we also would like to utilize credible messenger models and outreach and connecting young people to services, as well as additional services to young people who are currently incarcerated. I would say that our department is committed to collaborating with juvenile courts, the Department of Human Services, and all other local juvenile justice stakeholders to make informed decisions and determine the best needs of young people as it relates to resources in at-risk communities. Vanessa?
Thank you. And for any additional questions, please contact myself @prb@delcohsa.org, David Irizarry @irizarryb@delco.co.pa.us, or Danielle DiMatteo @DiMatteo at delaware.co.pa.us. Thank you.